Bonginkosi Mthembu is HIV positive. When he first found out, he was working as an HIV counselor and tester.
Every day I was giving out like results telling people whether they are HIV positive or they are HIV negative. And I didn't know my status by that time. So I then decided to test myself to see if ever I'm HIV positive or negative. And then the results came back positive. And then it was a bit of a shock because I knew about HIV and I knew about prevention, but I then found myself being HIV positive.
After being put on ARVs, he found it hard to keep up with his treatment.
At first, I started taking 5 pills a day, but it was difficult for me to adhere to my treatment because of like thinking of that whole cocktail that you have to take. And then it was sort of difficult for me because of like I'm always on the road. I travel a lot with my work and I take my medication at 8:30 at night. So having to carry all these 3 different packages of medication, it wasn't easier for me, and then it made it difficult for me to adhere to treatment.
Bonginkosi is at his local clinic for a checkup and to pick up his new fixed-dose combination treatment, or FDC. FDC is a combination of 3 ARV tablets into 1 tablet.
These 3 tablets are combined into 1 drug. That's why it's a fixed dose. It's the same strength for the same drug to be taken. It has got the same effect on the patient. It's just that it has limited the number of drugs. It's much simpler now. It's 1 tablet.
Not taking your ARV treatment properly every day can be very dangerous, as it may make you resistant to your medication. FDC makes it simpler for patients to take their tablets.
It is very good for the patients because most of the time our clients, they tend to default because these drugs are many, the 3 as compared to 1, and also the time, it's only 1 at night. It's more convenient for most clients that are working during the day, and also it's more convenient also for our pharmacy, like for storage, to store in the pharmacist, like to order just 1 drug.
FDC treatment will be rolled out to patients in several stages.
Our first priority is pregnant women. We issuing this drug to all pregnant women irrespective of their CD4 count. So we're issuing it to all of them. On their first visit, we do their pre and post-test counseling, and we find out if they are positive, then we initiate the drug straight away so that like we produce healthy babies as part of PMTCT, prevention of transmitting from mother to child transmission of HIV and AIDS.
Also, patients who are going on ARVs for the first time and patients who have both TB and HIV will be receiving FDC treatment first.
Clients that have both TB and HIV, this is more beneficiary to them because in the morning they have to take their TB treatment. It's better if it's FDC, 1 tablet at night. It's more convenient for them. It will prevent our clients from defaulting.
It may take several years, but eventually all HIV-positive people in South Africa who are on treatment will have access to FDC. It's important that until then, patients continue to take their separate ARVs.
There's no difference between FDC and the triple drugs that people are still taking because of like they had the same ingredients, and then the only difference that like with FDC, all these drugs they have been combined in 1 pill.
For Bonginkosi, taking FDC treatment has made a great difference.
It has improved the quality of my life because of like now I just know that like I have only 1 pill to swallow a day, and even when I'm going to work, sometimes like I'll work like overtime, and then I have to knock off maybe late, but like I can take my medication with me, just 1 pill. It will, as if like you're having like your 1 sweet with you on your pocket, then you know that like when the time comes and then you have to take it out and you drink it, and then no one can see you taking your medication. And for those people also who haven't disclosed their status yet and then who are not open about their status, it is much easier for them as well.
Being HIV positive hasn't stopped Bonginkosi from living a normal, healthy life.
For us, people who are on chronic medication for life, and then it's much easier to take like 1 pill once a day instead of having the whole cocktail of medication. And because of, you know that all the drugs that you need, they are there in that 1 pill.